views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is a pleasure and a privilege to welcome Dr. Linda Cottler, Professor of Epidemiology and Associate Dean for Research at the University of Florida, Gainesville. Linda, welcome.
Thank you so much, Bill.
Great. It's so great to have you on. Linda, I don't normally start the show this way, but I must say that part of the purpose of this program is to kind of humanize academics and let folks know in the Bronx and elsewhere that by going to college, they can set a course for themselves for a profession instead of a job. And I remember in my early 30s, many, many years ago, going to a national conference and looking across the room and saying, wait a minute, is that Linda Cottler? I've read most of her papers. I know that she's an expert in drug dependence epidemiology and intervention. And I went over and my mentor at that time introduced me to you. And you were very kind and gracious. Fast forward many years later, my wife and I would make the journey to University of Florida, Gainesville, the best national public university in the United States, if not the world, by virtue of your being there. So it's a pleasure to have you on the program.
It's a pleasure to be here. And I remember the time when we met, and it was just wonderful.
Thank you, Linda. So tell us a little bit about, some of the recent work you've been doing, your lab, and you've always got multiple grants going. What would you like to tell us about?
Sure. I would like to say that this has been just a wonderful career of being able to understand behaviors of people. And I've done a number of studies in my career, but what I'm doing right now is really two-pronged. One of them is really focusing on the effect of the pandemic, COVID, and the other is really looking at new drug trends around the country. So every so often a new drug pops up, or maybe just a new version of an older drug. And that is one of the things that the National Institute on Drug Abuse is really interested in learning about. And so we competed for this grant. They only give one, and we won that award, Bill. And it's been so exciting to participate with all of my colleagues here at the University of Florida and actually even in New York University.
That's great. Tell us about the grant. That sounds exciting.
Sure. So one of the things we're doing is to understand more about surveillance. We're looking at these new drug trends. So we have many different ways of doing it. We are looking at social media with our friends at the Florida Atlantic University in their robotics lab. They're looking at Reddits and subreddits to see what we can find out. We're also looking at the human response, so people telling us what new drugs they're taking. And we're also looking through many different indicators with 18 different sites around the country, trying to find out what they know about what new drugs are happening in their area.
Tell us about, for our audience, tell us that may not know what Reddits are. although in fairness, probably everyone from age 12 to 22 will, but people in my age bracket may not. What are Reddits, and how are you utilizing them to foster the research?
So the Reddit is the specialized social media page for any particular topic, from radio to music to drugs. And what we're doing is we're looking within the Reddits to find out what kind of chatter is going on about different drugs. This helps us to know not only what drug trend there is, but also some of the effects of the drug. And it really then allows us to then pair that information with information that we get from our Sentinel sites. Those are the sites that we're looking at that would be really great sites to find out what's happening in this area. And so we are looking at that area. We also have a lot of information and data from emergency medical technicians. So we have data from all across the United States that is about 75% of it is entered within 24 hours. So we can see what the emergency medical technicians are responding to. And then we can say, here is a hot spot.
So that's absolutely exciting and fascinating. Let me ask a two-part question. One, are you seeing urban and rural differences in use of drugs, drug type? And what are the key drugs of use these days?
Really good question, Bill. So we do see differences geographically and in terms of urbanicity, urban versus rural. So for example, if we want to look at the overdoses from methamphetamine, we know that they're in the West Coast. And we can see from this map, from these data, what are the top counties where those overdoses are occurring. And then if we want to look at fentanyl and heroin overdoses, then we see that on the East Coast. And you can almost see like going up Highway 70, Interstate 75, and you can just see these pockets. And you can also see areas where there's rural areas and urban areas that look quite different. So what's interesting about it is that we're looking for ways that we can intervene and for prevention. And so there's just, other ways that we're looking as well. We've got information from the Office of the National Drug Control Policy. This is part of the White House. And we're looking at their data to see what drugs they have seized across the country. And we can also pair that data with these data and with, the data we get from human responses to see if there is a pattern and what can we do about it.
So you just predicted my next question. How do we take all of this data mining, this great data, and translate it into policy change? What is there an arm or an element of your work or your grant generally that seeks to do that? And how does one do that?
So this is a grant that I have just dreamt about for years. My whole career, I've thought about how can we look at the surveillance? How can we understand more about what new drugs are coming up? How can we pair that with some of the chemistry part of science? How can we look at the epidemiology or the population science part of it? And how can that also translate to policy? And policy will happen when we know more about what's happening. And if we know that this is just a fluke, it's just a little, like a little signal, but it's not happening everywhere. It's not something we would delve into. But when we look at the map and we can see across the country all of these places where there are high rates of overdose and new drug trends, then we need to think about ways that the governments and local, regional, and national can help to understand ways that we can intervene with medications, with treatment, with Narcan, which is a overdose. It's a drug for overdose. It's a nasal spray. And if everybody in the country would carry Narcan, we could really help with the overdose crisis.
Do you think that there's sufficient training among EMTs and other frontline medical professionals with Narcan, or is there still a ways to go in terms of getting what's needed out to the population that's at most risk?
I think there's some, of each. I think that there are some places where people are tired and they've used it a lot and they keep seeing the same people over and over again. And then there are other places where there are true needs of new medications, new overdoses. And I think that it's really going down, sifting down to populations, community members who really want to carry it with them and they really want to be part of the solution.
Sure. So I know that another aspect of your work is a community-based clinic that provides a wide range of services, both in terms of assessment and intervention. How does this national project, or does this national project link to that more regional effort?
That's a good question too, Bill. So it's called Health Street. That's our community engagement program. And it's a way that we can really connect with the population in the community. So we assess people for their needs and concerns. We link them to medical and social services and give them opportunities to hear about research. And then we're also doing this to have a bi-directional communication. And then with all of this, we're being more trustworthy, because that's one of the things that's really important is trust. And so with this Health Street model, we have community health workers, promotoras, and they go out every day to the community, talk to people about all those things. We give out Narcan. We ask them about different concerns that they have. And all of those things are brought back so that we can help to deliver new treatments, deliver new services, have things that people need so there won't be any barriers to access for like babysitting, transportation, all of those important aspects of care.
And that sounds great. What do you see on the horizon? And if this is too broad a question, you just tell me and I'll rephrase. You're doing national surveillance, you're doing local and regional direct outreach. What do you see? I mean, here's what I'm thinking of. I'm thinking of the early 70s when therapeutic communities demonstrated enormous benefit to men and women who came back from Vietnam. And everybody thought that heroin was going to be the plague of veterans when they came back. And in fairness, by virtue of therapeutic communities and other kinds of interventions, men and women who came back from Vietnam were treated, and many of them did well. Not all, but many. Where are we today in terms of the cutting edge of treatment that enables folks that need the help to get the help?
Mm-hmm. Well, a lot of studies right now and a lot of science is really focused on the social determinants of health. Mostly social determinants of ill health is what it is. It matters where we live, and it matters, people who are 1 mile apart can have a life expectancy that's quite different from others. So we're learning about how we can intervene, because let's face it, we've known some of these things, but it's never been really a national conversation until this pandemic came on top of all these epidemics of hypertension, blood pressure, epidemic of diabetes, depression, mental health, and stress. And so all of those things were really brought to our light. And so we need to find out how we can best help people with even food insecurity, other things like this. So we are learning how to intervene with ways that we can do these kinds of town hall meetings. We can also have telehealth so that people may not necessarily traveling to get their health care. But all of these things are starting to forge new ideas on how we can best help community members.
That's wonderful. We're going to take a quick break. When we return, Dr. Linda Cottler is going to tell us a little bit about her personal journey that led her to have such a fabulous career in epidemiology and drug dependence epidemiology. We'll be right back with Public Health America. Welcome back to Public Health America. I'm your host, Dr. William Latimer. I'm so pleased to welcome back Dr. Linda Cottler, Professor of Epidemiology and Associate Dean for Research at University of Florida, Gainesville. Linda, at this segment of our program, we talk about the personal journeys of our guests to let folks know that, we want more people in the Bronx, NYC, and beyond to go to college because of my belief that college sets the stage for a profession as opposed to a job. If I may, where were you born and what were some of your formative experiences?
Well, I was born in St. Louis, Missouri, and there were 6 children in my family. I'm second oldest, 5 girls and 1 boy. My father was a blue-collar worker. My mother did not work outside of the home. So we didn't have a lot of money, and going to college seemed like a really big leap for me and for others in my family. But my mom and dad always thought that what was really important was that we strive to be the best that we can, and they always wanted us to work. So when I was 14 and a half, I had a job. I had a job when I was 15, 16, ... So all the money that I made, I would try to save up so that I could go to a good high school. And then from high school, I could pursue something in the area of a college degree. Well, I wanted to be a nurse. So my story is a little different, Bill, from maybe others. So I went to nursing school, and with nursing school, we went to a community college for all of our science. And then from there, we could go on to use that as a foundation to go someplace else.
That is, let me just interject. That is so great. First of all, I have to ask, so what was it like for your brother being one boy with all of those women? Was he taken care of, or was he beaten up, or a little of both?
He was in the middle. So that was really double jeopardy. He stood his own ground.
Okay, good.
But,
glad to hear it. So I have 2 sisters and 2 brothers, so not quite the same, but I understand. So the other thing that's extraordinary about your story that I absolutely love is that you went to nursing school by way of a community college, because let's all just agree that community college is A, great idea, B, accessible, whatever the next letter is, affordable. So that was something you did to sort of set the stage for what became the next level. Talk a little bit about that, please.
Sure. So then I was a pediatric nurse for a couple of years. And from there, I just decided that I really wanted to branch out. So I threw a dart at a map and closed my eyes, and it came up to the East Coast, and it came up near Boston. So I moved myself to Boston. I got a job, and it was, being a nurse interviewer. And then I decided, I'm not going to be able to advance unless I do something with my degree, with going to, finishing up my degree. So I went to an all women's college in Boston that allowed me to go to school on the weekends and in the evenings to get my bachelor's degree while I was working. I went to Emmanuel College.
That's so great. So this is so tailor-made to this program, Linda. I can't thank you enough. So you got your associates, you got your nursing degree, you worked in the field, but then you came to the conclusion that in order to advance your career, that you needed to go to the next level, and yet you couldn't go full-time traditionally. So you went evenings and weekends to sort of further your education. Fantastic. Next.
Well, I couldn't go full time because I had to pay for my way, and I had to work. So I worked and went to school, and then when I finished that degree, then I could move on to my next job, my next level of the job. And of course, from that point on, my boss told me if I wanted to become a leader in my area, I was going to have to get my master's degree. So then I went to Boston University to get my master's in public health because they also had one of the first programs, weekends and evenings, so that I could continue to work and also get my master's in public health. And that was just amazing because you're motivated, you've got energy, and yet you just can't take off 4 years, 3 years, 2 years to do this when you need the money. So that's what I did to get my master's in public health. And after that, it was just, the whole world was open to me. And that's when I was married at that time. I had a baby. My husband and I decided we wanted to move back to St. Louis because there was a fantastic job. And when I got back to St. Louis, then my mentor, who was, I didn't really realize who she was. She was a very famous epidemiologist, but she said, Linda, you really need to get your PhD. And I didn't know anybody who had a PhD. No one in my family had a PhD, but she was, nice enough to help me through it, to show me the way. And again, she let me work at the same time I was going to school. So it took me a little bit longer, it took me 6.5 years, but that was how I got my PhD.
That's great. And was that at WashU or what?
Washington University.
And that was with Lee Bone, or who was that with?
Lee Robbins.
Lee Robbins. Okay.
Yeah.
Forgive me. So Lee Robbins was your sort of seminal mentor, and it really was she who said to you, you can do this.
You can do it. I said, I cannot do this. I can't take any tests. I was really bad at taking tests and so, but now those tests aren't really needed. What's needed is to show that you're motivated, show that holistically you can do this. And I knew I could do it, but I didn't have those other kinds of things that other people I thought had. But she gave me the confidence to try it and to do it. And it's been fabulous life. It's been just a fabulous career. And I just want to say I was 36 when I got my PhD. And I have 3 daughters, and my youngest daughter, Sarah, is 36. And 2 weeks ago, she just got her PhD.
Congratulations. That's wonderful. That's wonderful. I mean, the heartfeltness and of your story is so palpable. But at the same time, there really are signposts of things you did from your associates, nursing, very practical, also very outward facing, service oriented, knowing that you needed to finish your undergraduate, then getting your master's, making your way back home, and then a critical mentor at a critical moment supporting you. It's not that you didn't think you could do it, but it was a new path.
It was a new path, and I wouldn't have waited till I was 36 if I had known all of these things. So this program, Bill, if we can say anything to anyone, it would be like, don't wait. Just do it, because you can. You can. Don't wait.
I couldn't agree with you more. And I think in addition to don't wait, we all come from different backgrounds. Obviously, the Bronx is an incredibly diverse community I just led a panel with a number of students that are facing a wide variety of challenges. Challenges are unique. People are unique. At the same time, you worked since you were 14. No one gave you anything. You worked hard, and you went to school evenings and weekends. And in your mid-career, let's call it, of your education, you had a spouse and a child, but you still found a way, and mentors helped you. So I think if there's a message to send out to the community, it's to say there are people who are going to care for you at whichever college you choose. So get there, and there will be people that will help you along the way. Are there other, with just a minute or two left, is there linkages between your experience and, with Lee Robbins, was it her area of research that informed where you ultimately went, or was it a confluence of factors that kind of influenced the area that you focused on?
It was this big word called serendipity, which is when things just happen and you just meet people and you just happen to happenstance. And her area and my area were so aligned. And it was just great. And so what I would say that to people who are listening, don't be afraid. Just think about all the opportunities there are, and look out for people like Bill. You can reach out to me. There are a lot of people in the Bronx who are there to help you, who have gone through the same thing, and they would want nothing more than to help you achieve the best.
Fantastic. I want to thank Dr. Linda Cottler, Professor of Epidemiology and Associate Dean for Research at the University of Florida, Gainesville. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time here on Public Health America. Take care.